Thanks, Susie. Dr. Andrew Forsyth with us, our Ask an Expert today. Thanks for being here.
My pleasure.
I've seen a bit of a spike in warm weather recently, and lots of questions from folks about fleas. It's an unusual time of year to be worried about fleas.
Usually January is not really flea season yet, but my wife and I were out yesterday, shorts and t-shirt. This is when things start to roll. If we get our regular January, February, the fleas, at least in the environment, still stay dormant. Now you have to remember that in your house, it's always flea season, right? Because it's warm, it's humid, fleas reproduce then. They like those temperatures. So as we get into spring and summer, when we start to get more and more warm weather, humid weather, fleas get a little more active, certainly in the environment. So we've got a picture here of dog being flea combed. Just going over the life cycle really quickly. Mom and dad flea on a pet, they fall in love. Mom has babies. They lay about 50 eggs a day on the pet. And so those eggs fall off into the environment where your dog or cat goes. So if they're sleeping in your bed or what have you, and they have fleas, they're dropping flea eggs into your bed or into their beds.
Yuck.
Okay, so this is where the problem happens. The environment gets contaminated, and that's how you get a flea problem.
So lots of products out there.
There's tons of products. We've got our, actually one of the very first ones, Program. Now Program isn't available for dogs anymore, just for cats, but you can still get it in this product, Sentinel. I really like Program. Program was one of my favorites when we've kind of switched to Sentinel. Sentinel is a Program with a dewormer in it.
Okay, and how do these work?
Basically, Program will sterilize the fleas. Okay.
So they still bite the pet, though? They
still bite the pet a few times. The eggs that they lay are non-viable, and you just don't get a problem.
Okay.
Okay. Moving back to another oldie but goodie, Advantage. Advantage is for both dogs and cats, and this is a topical as opposed to an oral. Again, highly effective, kills fleas often before they bite, but it's a topical, and some people don't like topicals. Now kind of the newer generation ones. Comfortis Spinosad came on the market. It's another very, very effective product.
Okay.
Trifexis is another one. It has the same dewormer as Sentinel, but still, we've got all these products now that we can combat. And each has a little bit different use.
Okay.
So see your veterinarian, they can advise you on the best product for your pet in your situation.
Lots of products, but we still have a lot of fleas.
We still have a lot of fleas, yeah.
Okay, thanks for that, Dr. Forsyth. Right, Luke is on the line from Burnaby. Good morning, Luke.
Morning.
Good morning.
What's your question for Dr. Forsyth?
We have an 8-year-old cat that had dental work done.
Yep.
And sometimes she'll be laying down and she makes a lot of noise and her eyes get really glassy. We're wondering, if she's in pain.
Actually, pain is a really good question. Probably, your cat's probably not exhibiting signs of pain there. I'm not sure what she's doing, but it doesn't sound like pain. But oftentimes, dogs and cats will hide their pain. We see that with dental disease. We see that with arthritis. It's normal for them to kind of hide their pain so they don't signal to other members of the pack that I'm sore. Historically, it was hard for veterinarians to recognize. We've got a much better handle on that now, and you'll see a lot more pain relief being used. We have products for arthritis, dental disease now. We're a lot more proactive on getting on top of that kind of stuff.
So best to take the cat back to the vet, maybe?
Yeah, and show them, take some video if you can. That's very helpful.
Okay,
so.
Good one. Karen from Surrey is on the line. Good morning, Karen.
Morning.
Hi.
What's your question?
I've got an orange tabby cat, female, and she's constantly licking herself, like all the time. It's almost like she's itchy, mostly on her front paws, her back end. Can't see any fleas. Don't think that that's it.
Okay.
Almost like she's allergic to her own skin.
Yeah, it's not unusual. Dogs and cats do get allergies. Check her for flea dirt as well. Oftentimes you won't see fleas. Some dogs and cats are very good at actually getting the fleas and swallowing them. They can get worms that way as well. But look for flea dirt or flea poop. That's a telltale sign. The other thing is sometimes they can be allergic. Sometimes they can have inhaled allergies, house dust, pollens, things like that, or food allergies. Next time you go in to see your veterinarian, show them, get their advice.
Okay.
Okay.
Good advice. I hope that works out, Karen. And we have an email question from Coral who says, if we leave our bedroom door open, our female tabby cat does her business on my husband's side of the bed. He's always been good to the cat, so why is she doing this?
This question actually really needs about a 10-minute answer. But it can be dietary. Some cat foods will cause crystals in a cat's urine, irritates the bladder, and cats, and this is kind of their cry for help, will pee in odd spots. You'll see it in sinks, bathtubs, laundry baskets, things like that. Sometimes it can be an odor type of thing. Try changing your bedding a little bit more frequently. If it's just your bedroom, just close the door and prevent that. But check your diet, check for urinary tract infections, check a ton of things like that.
All right. Good luck, Coral. Yeah, it is hard not to take that personally.
Yeah.
All right. If you have any more questions for Dr. Forsyth, check out his website, comolake.vet.com, or search for Como Lake Veterinary Hospital on Facebook.